Good morning, viewers. My name is Rumi Rahagi, and you are watching SI News Live. Today, we'll be covering the recent increase of mental health crisis among youth, with some sources noting that suicide-related emergency room visits for young people have increased every year since 2011. Researchers from University of Connecticut, UConn, School of Medicine, and other respected institutions reported that from 2011 to 2020, emergency room visits for mental health-related cases spiked among children, teens, and young adults. The report, published in the Journal of the American Medical Association, highlighted the continuing trend, first noted in 2006, and emphasized the need for socio-behavioral interventions. Concerns about young adult, teen, and child mental health have risen in the wake of the isolation following the COVID-19 pandemic. But according to the data from emergency departments in hospitals around the United States, mental health troubles among American youth began more than a decade prior to the pandemic. Taiho Gregory, UConn School of Medicine psychiatric epidemiologist, and colleagues from other respected institutions worked together alongside the VA Connecticut healthcare system to analyze data from the 2011-2020 National Hospital Ambulatory Medical Care Survey, or the NHAMCS. The NHAMCS is an annual survey of hospitals across the U.S. The 10 years of survey results included around 49,500 mental health-related visits for youth from the ages of 6 to 24 years old. They look at the reasons for the visits, the length of stay, and the treatment offered, as well as the sex, ethnicity, and geographic location of the patient. They found that mental health-related visits rose every year, climbing from 7.7% of all pediatric emergency visits in 2011 to 13.1% of all pediatric emergency visits in 2020. This result also revealed similar trends across all youth groups and regions of the country. The number of mental health emergency visits for suicide-related causes have also increased from less than 1% to more than 4% of pediatric visits. Ree stated that his team is aware of the overtime increase, noting that this is the first nationwide study to investigate it since 2016. Their results suggest that a growing number of youth have unfulfilled mental health needs in the community, but the emergency department is not the optimal treatment setting for children with mental health needs. The study results show largely similar trends across all regions of the country, affecting all races and ethnicities. This rise in emergency mental health visits and suicide-related causes has been reaching younger and younger children over time, as well as rising amid adolescents aged 12 to 17 and young adults aged 18 to 24. Suicide-related issues in elementary school-age children were vanishingly rare until recently. Ree said that they have no clue why younger generations are starting to be more at risk for suicide, but evidence-based suicide prevention efforts should include children and early adolescents. He ended it with studies that have shown, for example, that programs to help preschoolers manage their emotions can lead to reduced mental health problems in their adolescence. That is all our news for today. I'll be back at 12 a.m. for our afternoon news. But right now, stay tuned for our next program, ESC On Air, only on SI TV. Gimana?